Hello and welcome. You're watching Health and Wellness. Save a Life. I'm Gargi Rawat. It's a sad but true fact that the number of people dying from cardiovascular disease is steadily rising in India. Most of these cardiac deaths are sudden and on the spot. It's possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. The recent incidents of some celebrities collapsing suddenly and passing away due to a heart attack are concerning and very shocking. Now, there's an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. Can one make himself or herself capable enough to save a life in an emergency situation? Yes, it is possible if you're well trained in CPR. So raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPR in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR and highlight the role of CPR in saving a life. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR. We're joined by Dr. K. Venkatesan, interventional cardiologist, general physician, diabetologist, Kongu Hospital, Tiruvannamalai. Also Dr. Vikram B. Kolhari, consultant cardiologist, Apollo Hospitals, Heart Institute, Bengaluru. And Dr. Srinivas Mova, interventional cardiologist, Madhuri Hospital, Hyderabad. Thank you so much, doctors, for taking out time and joining us on the program today. And Dr. Venkatesan, first to you. Cardiovascular emergencies and symptoms are one of the most common reasons for patients' attendance in emergency department. What are common cardiac emergencies, if you could explain to us?
Yeah, cardiac emergency means actually it's related to heart emergency. The most common emergency what you can able to see in day-to-day activity or day-to-day emergency department in cardiology, the most common thing is acute coronary syndrome. In that, the first thing will be acute myocardial infarction. Apart from that, what are the emergencies we can see in the casualties? Congestive cardiac failure, patients presenting with acute pulmonary edema, or patients having acute pulmonary embolism or cardiac tamponade. In that, the most common thing what we see in day-to-day is the acute myocardial infarction. That means the blood supply of the heart. Imagine heart has got 3 blood vessels. If one of the vessel is having 100% occlusion due to presence of silent coronary heart disease, that time there is no flow in the coronaries. So that is the thing we can say as acute coronary syndrome or acute myocardial infarction. In this, we have to act very fastly. What is the thing we can able to do? We have to put the patient on loading dose like antiplatelets and statins, and then immediately within 1 hour, whether the patient is in PCA capable hospital or non-PCA capable hospital means, if it is non-capable PCA hospital, we can go for thrombolysis. That is clot lysing agents like streptokinase, tenecteplase we can use. If the hospital has got a facility of doing primary PCA means, you just give the loading dose to the patient and shift the patient to cath lab. There we can go for immediate coronary angiogram followed by angioplasty. If you are doing like this, we can able to save the patient.
All right. Dr. Mova, what is sudden cardiac arrest? What causes a sudden cardiac arrest, if you could explain to us?
At the onset, thanks Gargi for having me here. So sudden, as the name goes, is sudden. So if the heart stops within 1 hour of the presenting symptoms, whatever the patient experiences like giddiness or whatever, so it is called a sudden cardiac death. So typically it is caused by fast beating of the heart. You know, the lower chambers of the heart are called ventricles. If typically they beat 60 to 70 per minute, but if they go on to beat like 200 times, 220 times, then heart just stops. It cannot function basically because of the very fast heart rate. In those circumstances, the heart stops functioning. There is cut off to blood supply to the brain. So the person collapses. That's called as sudden cardiac. And if it goes on to death, it is called sudden cardiac death. As I said, its commonest cause is because of VF, ventricular fibrillation. It is called sudden fast beating of the lower chambers. 80% of this is again because of a heart attack. So we can generalize by saying that heart attack causes the sudden cardiac death in most cases.
Right. Dr. Kolhari, does the sudden cardiac arrest mostly affect people with a history of heart problems?
Yes, sudden cardiac arrest is basically when the heart stops pumping the blood. It's generally a pre-terminal event. Most common cause of sudden cardiac arrest is heart attack. So underlying coronary artery disease, blockage in the blood vessels that supply blood to the heart is one of the most common causes for sudden cardiac arrest. In younger individuals, the fatal arrhythmias like ventricular fibrillations are also equally important causes of sudden cardiac arrest. And sometimes underlying congenital heart diseases also could be a predisposing factor for having a sudden cardiac arrest. But it is more common in patients who have pre-existing cardiac diseases.
Right, Dr. Venkatesan, at a time when a good physique is the new cool, young adults are hitting the gym more often than ever. But why are youngsters and gym goers suffering from sudden cardiac death? We have had so many instances of late.
Yeah, this is the thing. It has been seen recently. Most of the young patients having a good physique going for sudden cardiac arrest and losing his life. The reason behind is these young patients might be having a silent CAD without knowing that they will be going for a isometric exercise in the gym like weightlifting. Suppose patient has got CAD with around 50 to 60% block in the coronaries. What will happen if they go for strenuous exercise means this block in the coronary will go for rupture. That is known as block rupture. That is the most common thing for myocardial infarction. That is one reason we can say for this sudden cardiac arrest in young individuals. Apart from that, what are the other things we can able to encounter for this sudden cardiac arrest in young individuals is most common thing is the hypertrophic cardiomyopathy. It's a variant of disease in the cardiac muscle and arrhythmogenic right ventricular dysplasia. And if myocardium is normal, coronaries are normal, again cardiac arrest means you have to think of some channelopathies like long QT syndrome, short QT syndrome, because these patients, this kind of condition will go for ventricular arrhythmia and ventricular fibrillation. Within 1 minute, if you don't intervene, patient will lose his life. So these are the various things we can able to enter for this sudden cardiac arrest, especially in the young individuals, because this is most commonly seen in sports persons, especially football players, basketball players. They will be very much active. But suddenly what they will happen in the ground, they will go for fainting. And if you won't see, they will lose their life. Because what will happen in that condition, patient will go for ventricular fibrillation. So immediately we have to use the AED and then we have to survive the patient. If you won't do it, naturally it's the loss of life for the patient. So reasons is these are the common things. Mainly channelopathies, cardiomyopathies in the form of hypertrophic cardiomyopathy, arrhythmogenic right ventricular dysplasia and silent CADs. So these are the reasons we can say for this young heart attack in young patients around less than 40 years of age.
Also, Dr. Kolhari, if you could tell us what are some of the emergency actions for helping someone experiencing a heart attack and cardiac arrest?
So, as you asked me, because of the science,
so science will be or sudden cardiac arrest. The most important thing is first call for emergency medical help. Make the patient more comfortable, either in a sitting or a lying down position. And if the patient is not allergic to aspirin, aspirin 300 mg tablets can be given to the patient in case of symptoms which are suggestive of a heart attack. However, if patient is unresponsive and there is sudden cardiac arrest, patient is not breathing well, then CPR is the most important thing. We should start with chest compressions. In fact, every individual should attend CPR classes to know the basics of cardiopulmonary resuscitation. Chest compressions should be started at the earliest. And in places like, say, airport or where automated defibrillators are available, we should get the machine and connect it to the patient. It generally gives us, it prompts us how to use it. If there is a rhythm which can be shocked and patient can be revived, the automated defibrillator by itself does the work. So it is crucial that at public places and airports, if automated defibrillators are there, they should be used. And most important thing is call for medical emergency help immediately and shift the patient to the nearest center where cardiac emergencies can be managed.
All right. And what are the signs and symptoms of sudden cardiac arrest? Dr. Mova, if you could answer that.
Well, symptoms will be known if the person comes back from dead. So usually we tell once it is resuscitated, then the commonest symptoms would be what is called as fainting. So a person loses he loses his consciousness and he falls down. So that's the commonest symptom. He can have sometimes like a racing of the heart, or sometimes because the commonest cause is, as I said, a heart attack, he can have chest pain. So, but as I said, these are the common symptoms, but signs would depend on the examination by the doctor at time of the presentation to a medical facility. So commonly there is loss of consciousness, there is very low pulse or even a lack of pulse, BP is usually not recorded, and breathing also is shallow or is sometimes absent. So these are the signs of cardiac arrest, meaning usually when the heart stops, usually the lung also stops working. So also the brain. So the signs of heart function will not be there, lung songs will not be there, and also the brain will be deeply unconscious. So these are the signs that can be recorded in a medical facility.
All right. With that, time for us to slip into a short break, but don't go anywhere. We have many more questions to ask the doctors. Stay with us. Welcome back. You're watching Health and Wellness, and we're talking about heart health and how you can save a life. Let's go back to our panel of doctors. And Dr. Venkatesan, when a sudden cardiac arrest occurs, CPR can save a life. So what are the correct steps of CPR?
Yeah. See, CPR is a cardiopulmonary resuscitation. That is the thing. It's a life-saving procedure that can be done in all patients who has got a sudden cardiac arrest. As already explained by the two speakers, what is the definition, what are the signs you can able to see in sudden cardiac arrest. CPR, how we can do CPR is, one thing, what is the guidelines given by the American Heart Association. The person who are doing CPR, whether they are trained in CPR, has got a ALS or BLS certificate, there are two different things. Suppose a patient faints, another person sees, suppose the patient is trained in CPR, it's no problem. Suppose they are not trained in CPR, what is the thing we can do is, you just put the patient on the back of the thing, and you just kneel to the patient, and what is the next thing you have to do is, you have to keep your heel of the hand over the center of the chest, and then you just interlock your both hands, and then you keep locking the both elbows, and the shoulder should be straight, and you give a firm compression. The depth of the compression should be more than 5 centimeters. That is the guidelines given by the American Heart Association. And then you have to go for very fast and hard compression. That should be around 100 to 120 compressions per minute. That is the thing. A normal layer, we doesn't know the steps of CPR, they can do like this. Suppose a patient, a medical person who is doing CPR, that is different actually. In that case, what we can do is, we have to go for that is previously it's ABC, now it's CAB. That means circulation, airway and breathing. So 2 persons are needed for adult. The ratio what is given by this American Heart Association for adult is, it's known as 30:2. That is for every 30 compressions, another person has to give 2 breathing. That is the one which is given for adult. Whereas in case of pediatrics or infants, something is different, 15:2. That is the thing, CPR is done for all the patients. This is mainly in patients who has got sudden cardiac arrest. Sudden cardiac arrest means there will be no any breathing, there won't be any pulse. If it is AED is available, well and good, we can go for just defib, we can able to save the life of the patient. So these are the proper steps of CPR.
Right. Dr. Mova, what is the role of cardiac rehabilitation for patients who have suffered a cardiac arrest?
So this is towards the end of the story. When the person has a cardiac arrest, some treatment is done, like angioplasty or bypass, and then patient is fit for discharge and then discharged. So the medical prescription needs to be, whatever is given by the doctor needs to be effectively implemented by the patient for quick scientific improvement and long-lasting improvement. In this case, the improvement of the heart function basically. So for that, it is usually customized to the patient's needs, customized according to the function of the heart, what we call as ejection fraction on echo. And so it is customized to patient, and the rehabilitation is mostly regarding the exercise program and educating the patient of how he should go about his life, how quickly he should start his daily activities, like driving a vehicle, going out, and all these things. So as I said, this usually it starts the day the patient is discharged according to the prescription given by the doctor at time of discharge. This goes on about for 3 months. And most of the patients who are admitted in cardiac ICUs, whether they have a heart attack, whether they are recovered from heart failure, they underwent angioplasty, stent, or even a bypass or valve replacement. So most of the heart conditions, when they are admitted in the hospital because of an emergency, when they go out, the rehabilitation aids in bringing them back to life quickly. So by helping them the exercise needs, educating them regarding the heart related problems as well as the risk factors for heart attacks like diabetes management, BP and all that. So it's aids in the patient's recovery as quickly as possible. So this is what is cardiac rehabilitation.
All right, and as you doctors say, prevention is better than cure. So, Dr. Kolhari, what lifestyle should one follow to prevent sudden cardiac arrest?
So, the prevention of sudden cardiac arrest mainly depends on risk factor modification. As the most common underlying cause for sudden cardiac arrest is heart attack, we have to look at the risk factors that are there for heart attack, and we need to modify the risk factors so that we can prevent a heart attack. So, basically, if somebody is a hypertensive, we have to look at the blood pressure regularly, keep the blood pressure under control. Diabetes, diabetic patients should get their sugars checked regularly and control the blood sugars. Then patients who have dyslipidemia, that is high cholesterol levels, need to take proper medications as advised by the doctor to keep the cholesterol under control. Maintain a healthy body weight and follow a healthy diet. Somebody who's obese needs to lose weight. Physical exercise is extremely important. At least moderate intensity exercise on most of the days, in the sense at least 5 days a week, is very crucial in prevention of a heart attack. And diet is also very important. We should avoid saturated fats, reduce carbohydrates in our diet, reduce the total fat content in our diet, and eat more and more fruits and vegetables, which are rich source of antioxidants, which also help in preventing heart attacks. Another most important preventive aspect is quitting smoking. If you look at smokers, if somebody quits smoking, the risk of having heart attack for them becomes equivalent to that of a non-smoker by 1 year. So, smoking cessation is the most important form of prevention that one can have, so that we can prevent the incidence of occurrence of heart attack or sudden cardiac arrest. At the same time, it's most essential that we maintain a healthy diet and healthy lifestyle, a daily exercise regime that is very important. And at the same time, manage mental stress. Stress management also goes a long way in preventing a heart attack. So stress relaxation techniques, yoga, meditation, all of them help in reducing the risk factors for heart attack and prevents the occurrence of heart attack in the longer run.
All right. So there we spoke about, diet and various steps we can take. Dr. Venkatesan, is there a role between dietary cholesterol and heart disease? If you could explain that to us.
Yeah, this question is a funny thing actually. To be honest, to say about this answer, actually there won't be any much relation between the diet cholesterol and the body blood cholesterol. But most of the people are very much mindful in taking cholesterol because there are some genes which are responsible for the dyslipidemias in the patient's body. That is known as hyperresponders. Normally, body has got a system. It has got auto-regulation because in liver, once the patient takes more amount of cholesterol, it naturally decreases the cholesterol production in the body. If you see the cholesterol, there is a good cholesterol and bad cholesterol. Good cholesterol, what we say is HDL, that is high density cholesterol. Bad cholesterol is a low density cholesterol. Once the patient takes more amount of saturated fats, normally body has got a property of decreasing the production. That means if the cholesterol is there, it will produce both bad and good cholesterol very equal amount. So the effect is neutralized. But there are some conditions like familial hyperlipidemias, hypertriglyceridemia. There are some conditions where naturally there will be more production of more LDL, and the size of LDL also more important actually. If the patient has got a LDL of very large, that is a large LDL, it's non-atherogenic. Whereas small dense LDL is a very much atherogenic. And HDL is a very good cholesterol that is essential for patients. And there are some drugs apart from this dyslipidemia. This cholesterol is not only reason for dyslipidemia. It only produces the most common diabetes mellitus, hypertension, obesity. These are the various contributing factors for all cardiovascular diseases. And we have got a very humpty number of drugs to reduce the cholesterol, mainly to decrease the LDL, to increase the HDL. The most common thing what you can use for this decrease in the LDL is the statin. That is HMG coeridicase inhibitors. Depending upon the risk level by using the atherosclerosis cardiovascular risk score, whether it is less than 5% or 5 to 7.5%, 7.5 to 20% or more than 20%. This 20% ASBD risk is very high patients, high risk for dyslipidemia producing heart disease. So in that case, we have to go for high intensity statins. Mainly you can use atorvastatin or rosuvastatin. If you are giving rosuvastatin, we have to give the maximum dose of 40 milligram. Atorvastatin, we have to go for around 40 to 80 milligram depending upon the patient tolerability. So next thing, to reduce the triglycerides, we can have another group of drugs like fibrates, that is fenofibrate. It has got the property of producing more amount of decreasing the triglycerides levels in the body, and it has got another property of increasing the HDL. So that is a good cholesterol. So that is the property of fenofibrates. Apart from that, the vitamins, there is niacin, nicotinic acid, has got the property of producing increasing HDL level. That is the one good thing about niacin. Apart from this drugs, that physical activity. Suppose a patient does walking, daily walking or around 20 minutes or 30 minutes. That is the one which gives increased amount of HDL in the body. Apart from taking drugs, natural thing to produce increasing HDL is we can go for physical walking. The guidelines what is given by this walking is, if the patient goes for daily walking, around 30 to 45 minutes is enough. You can't able to go for daily walking, at least weekly thrice. What is the AHA given for walking is, at least it should be more than 150 minutes per week. So these are the guidelines given by the American Heart Association. If you are following like this, we can able to decrease the cholesterol, we can able to increase the good cholesterol, that is HDL. By taking drugs, we can able to decrease the triglycerides and LDL. So these are the things we can do for this dyslipidemias.
All right. Dr. Mova, if body weight is in control, then does it mean a person's blood lipid levels would be normal and he and she cannot get heart disease?
Body weight is an indirect reflection of the metabolism of the body, as my previous speaker was alluding. So 80% of our blood cholesterol comes from the intestines, means from the mouth, what we eat. Only 20% is what is synthesized by the liver. So intrinsically, body synthesizes cholesterol, but it's negligible. Mostly it is what we eat that causes the dyslipidemia. Dyslipidemia is a manifestation of obesity, which is common in India. We are the diabetic capital of the world. So it's no wonder that we are the heart disease capital of the world. So body weight reflects bad metabolism, which is called as metabolic syndrome in medical parlance. But it is an indirect evidence of bad metabolism and bad lifestyle, to generalize that. So managing weight goes a long way in managing your lipids. So weight management, as again my previous speaker was saying, it's mostly dietary and exercise. So correcting the metabolic defect which causes the various problems. It is funny if you think that the diet is causing a heart attack. So, but it's actually so. We as a culture are adamantly non-exercising, adamantly rice-consuming or even carbohydrate-consuming culture as a whole. Of course, it is more in southern part of India. North, it is less of rice, more of other things. But so our diet plays our cultural and beliefs like for dietary and lack of exercise. These are playing a major role in the obesity, what is called as metabolic syndrome. And then that causes the various heart diseases. Then basically that causes diabetes, hypertension, and all that. That later it leads to heart attack. So you can say if A is equal to E, when A is equal to B, B is equal to E, then heart attack is caused by bad lifestyle, bad diet.
All right. Well, thank you so much, doctors, for joining us on the program and creating awareness about this very, very important issue. Thank you. And thank you all for watching at home. Goodbye.